hyperactivity is a child is hyper, which is so commonly used, So hyperactivity is where they cannot stay in one position for a long time. Like for example, the child cannot be seated there for some time. Child get up, want to go there, lie down on the couch.
But again, that is childhood. Like every child we see around us, that's childhood.
But this is...
Hello, Namaste, Assalamu alaikum, Sat Sri Akal. Dr. Naeem Sadiq, neurologist, neuropsychiatrist, founder and director of Plexus Neuro and Stem Cell Research Center.
Welcome to the Dr. Brain STEM podcast, your portal to understanding the complexities of neurological disorders. Today with Plexus, we are focusing on the common neurological disorders amongst children, their early signs and symptoms. Together, we're committed to raising awareness, enhancing knowledge, and exploring how this condition affects the daily lives of patients and their families. Guiding us through today's discussion is Ms. Kanishka, a seasoned occupational therapist with a master's in occupational therapy and the head of the Department of Rehabilitation.
So hi, how are you doing today?
Awesome.
So after we have spoken so much about adults and so many neurodegenerative conditions, let's talk about our most favorite clientele, our children. And I've seen so many children coming into the OPD every day. There is a whole lot of noise and I see children running around and parents trying to catch them. And it's really become a thing nowadays after COVID that there are children who are having so many of behavior problems, speech delay, communication problems, a lot of complaints from the school teachers. So I thought let's talk about a new topic, which is neurological disorders in children. So what would you like to tell us about these neurological disorders?
Yeah, it is definitely a very interesting topic, and more so now after COVID, since people were locked in there for 2 years, 2.5 years. So many problems which hitherto were not noticed or not seen have now come out in open. Parents are realizing that yes, my child, I think, has a problem. He or she needs a consultation. Let's go to a doctor, to a specialist. So it has come out. So I don't know, like I always believe, whenever something goes wrong, maybe there is something good also hidden there. A lot of children with problems have come out after COVID, yes. So there are a lot of cases which keep coming here. And in fact, Saturdays, my entire outpatient, 80% is only children.
Wow. So what are these cases and what are these conditions that you see most often in your OPD?
Well, if you ask me to say what are these conditions, I would try to group them into various kind of disorders. One would be a group of disorders which are predominantly behavioral, where the top one would be ADHD, which has become so common. I keep getting people of all ages nowadays. Okay, ADHD is attention deficit hyperactivity disorder. Second one is dyslexia, where children have difficulty to read, to write, to spell, and to understand what is written. 6 becomes 9, D becomes B, L goes the other way. Many majors.
On this, a very popular movie.
Very popular.
That is, I mean,
exactly. And after that, my OPD used to be full. And everyone was like, yeah, it doesn't mind, just examine if my child is suffering from that. So ADHD, dyslexia, and the third one, a huge cluster, a big group of people, children suffering from autism spectrum disorder, ASD. That's one part. The second part is where children have developmental delays, cerebral palsy. So these could be either because of birth injury, lack of oxygen during birth, or some genetic factors. And neuromuscular disorders, the most common being muscular dystrophies. And we have a third group of disorders, again, which is extremely common. One is epilepsy, where there are different types of epilepsies.
Seizures,
or commonly people call them as fits. There are different terms. So, and of course, migraines. So I can see that look on your face. Yes, we keep seeing so many migraines. Migraine is not only confined to adults. Even children have migraines. So these are the commonest kind of problems which we come across here.
So, in what proportion do you get these cases on a daily basis?
The way I described, the behavioral ones, the learning disabilities, ADHDs, ASDs, then we have the CPs, epilepsies, and migraines. In that order, but then not necessarily it's the same, but predominantly it is a behavioral which comes either the parents bring them or the schools refer them.
So, you've spoken so much about ADHD, and you see so many children with this condition in your OPD on a daily basis. So, can you tell us about this condition? What is ADHD, and what are these signs and symptoms that the parents should be aware of?
Like the term ADHD, it has two components there. The first one is the attention deficit. The second one is the hyperactivity disorder. So in the first part, the child lacks attention, is inattentive, is unable to sit and complete any given task. Now here I lay emphasis on the word any. It could be anything, be it homework, being television, being watching a game, doing any task which the parents or the sibs or the friends have given him or her. Child is just not able to sustain attention and complete the given task from the beginning to the end.
That's how childhood is.
Exactly. Childhood is like that. But now, if you remember your own childhood, if you see hundreds and thousands of kids around and what we see here and everywhere, if the child is given a task which he or she likes, they'll love to do it. Give them a game which they like, they'll sit for half an hour. I get so many kids here, the parents bring them and say, my child is not sitting, not doing homework, is very dull in the school. And then, so what does he do? He takes my phone and he's there on the phone for hours together. That's not the ADHD. I have had kids where the parents have brought complaining the child is not doing well in the school. When I sit and talk to the child, who's your favorite actor? Which movie did you watch last? The child is able to narrate the entire movie from the first scene to the end. That's not ADHD. It's just that the child lacks interest in that particular field.
Okay. So when it comes to inattention, what all is seen in the child?
Child is not able to complete the task, whatever is given to him. 2, they tend to make careless mistakes. Mistakes in spellings, mistakes, the words are missing or the sentences are missing. Like
in the classroom.
In the classroom, the teacher asks a question and asks the child to write. The child might be knowing the answer, but then when he writes, he will write only 2 lines and get it done. Will not even complete the paragraph. Is in a hurry, just wants to get done with the job. Spelling mistakes, jumbled up words, and incomplete task. So the careless mistakes. And because of this, he is not able to have a schedule, have a program or anything when the child has to do. Like for instance, I'll do 1, 2, 3, 4, 5, 6 incomplete.
Lacks organization skills.
Lacks organization skill. Cannot have a structure, which is so common. So common. They start with 1, go to 7, maybe come back to 4, and it's over. Because they don't even know where they've started and where should they end. They don't have the roadmap there.
Yeah, they're very random.
Very random. It's just like a bee going around buzz and then it just falls down. That's how it is. That is attention deficit.
Okay. Now what about hyperactivity?
Yes. So now, because you're not attentive, you just cannot. You ask me a question, I'll answer a bit of it, and then I want to jump to the next one, jump to the third one, jump to the fourth one. Hyperactivity is a child is hyper, which is so commonly used. My child is so hyper, I'm hyper, he's hyper. So hyperactivity is where they cannot stay in one position for a long time. Like, for example, I've heard this phrase so often, ants in pants. The child cannot be seated there for some time. Child, get up, want to go there, then sit on the table, then might go lie down on the couch.
But again, that is childhood. Like every child we see around us, that's childhood.
But this is sustained. See, in children who don't have this particular issue, if they are in an environment like they've gone to meet some guests, the child is sitting quietly. There's a program going on the TV. The child will sit and watch but this child will not sit, even if it is a stranger's house. That's the difference.
Right.
That's the difference. Like, for example, when I get a family, father, mother, a child with ADHD and a child without ADHD. The ADHD child is sitting quietly in the lap of the mother or father. But this one is there pulling my curtain there, picking up. Both of them, this is a new environment. But this child knows he or she has to be well behaved, well disciplined, sitting quietly. The mother says, shh, and the child sits quiet. But this one does not even listen to the mother and goes there, plucks something from there. So that's the difference between the children suffering from ADHD and children without ADHD. Okay. And then they're jumping, moving all over. As if like if you've seen a toy where the thing has been switched on. Like I've commonly used this phrase, as if, ask, do you have wheels on your feet? They just cannot stop. The zoop, zoop, zoop. They're going all over. Yeah. So these are the kind of phenomena you find because of hyperactivity. So one is attention, where they cannot sit and do anything, and then they're jumping and doing all kinds of things. Plus, even if they have to they're forced to sit. Take the ring, keep fidgeting, doing something. Take the pencil, keep doing something.
Something or the other.
Something has to keep going on. The legs are moving. All these phenomena will happen. So that is hyperactivity.
A lot of motor activity.
Because the thoughts are coming there. Things are happening. They don't know how to channelize it. They cannot run. They cannot do things. So while sitting, let me do whatever I can. Yapping. Okay. All kinds of things. It may come in each child. It may manifest in a different way.
Now, what about impulsivity?
Yes. Okay. Very, very interesting phenomenon. This is which is found in children with ADHD. It's just an impulse. I'll just give an example. I'm sitting and talking and I don't even know who this. Just go pull something from there and sit. Okay. Or take something and throw.
That's not being naughty?
Naughty is when the child knows what he has done on purpose to trouble someone. This is just an impulse. Now, if you catch the child and tell him, he said, I didn't do anything.
I didn't do anything wrong.
Yeah, you can see that innocence on the face, and the person is thinking, did I see something wrong? So it is just an impulse which the child does not know. The child cannot control that impulse.
It's an impulsive thought that makes them
them do something. Like, for example, now when I keep seeing this, the parent has booked a cab. The cab is going to take 3 minutes, and you know how cabs are in Bangalore. They say 3 minutes and it can take 5 minutes, 6 minutes. But then anyone will say, okay, 5 minutes, just wait. But this child will not wait.
Cannot wait.
Cannot wait. Set 3 minutes. It's 3 minutes and 10 seconds. So cannot wait. And even if there is something where you have to stay in a queue and wait for your turn, like if there's a game or some distribution is going on and child will jump there and do, unaware or not even thoughtful, he or she might be punished for that. They keep getting punished. They don't mind it because they're not aware of what they're doing. These are all impulses which come in and they enact.
So at what age group do we see these symptoms?
See, generally this is seen after 6 years, between 6 to 12 years.
Is it more commonly seen once a child starts going to school and there are complaints from the classroom teachers? And
I cannot say it is more common.
like, who are the first people to notice?
Of course, the
these
teachers.
symptoms?
Of course, the teachers. The simple reason being, when the child is growing at home, the parents keep looking at the child every day. So that mistake or that lack of attention or that impulsive behavior, they just accept it. That's how he is.
Yeah.
Just leave him alone. Or the entire family adapts to that child's behavior. But school cannot do it.
Yeah.
That's the reason, for the last my entire career, maximum number of children come to me from the schools, or the school writes a letter till you make your child all right that he cannot be admitted back in the classroom. Then they come and say, what can we do now? It becomes noticeable when they are in that structured environment where
And there are rules. They
there are
expect
rules.
you to follow rules.
Yeah.
And they're not able to.
They're not able to. Okay. And they do all these behaviors which at times can be harmful to other kids.
Right. So, what is the cause of ADHD?
See, there's no exact 100% definite cause, but it is environmental. And there are some studies where there's an issue with the neurotransmitters like the norepinephrine. So nothing definite has been established so far. But yes, there are some studies also relating to some genetic component there. So if one family member is suffering from ADHD, then there are the more likelihood chances somebody else also might suffer from this.
Like siblings can share the diagnosis.
Can share. Not necessary or not definitely, but yes, they can share. They're more likely to get it.
And how easy or difficult is it to diagnose this?
Easy or difficult? It is easy and it is very difficult. The reasons being the society, awareness. Let me just tell you the scenario which was there maybe about 10 years or even now in India, a large population where you have a joint family structure, where the father is an IT person or mother is an accountant or whatever. They both are busy in their own thing. They have a nuclear family. Every little thing which the child does, the parents come to know about it. Now, the same scenario, if it is there in a joint family where the grandparents are there, uncle is there, aunt is there, there's so many cousins, things just go unnoticed.
Yeah.
Because there's something happening, the grandmother will be pampering the child, or the grandfather or the mama will be doing, or the tau will be doing, or somebody else. The child finds that shelter and the safe zone. So this does not come out in open. That's the reason why there are a lot of cases they surface when the child goes to school, or when the parents move away, or like it happens now, they got a job in the US, or they got a job in some other place where they have to take the child and go, and they have to manage the child. That's, oh my God, we never knew our child was so naughty or so had so many issues. So what I'm trying to say here is that it is difficult in this situation, but then if you are aware, okay, these are symptoms or these are red flags. The child is able to sustain attention in something, whereas in some he is not. The child is hyperactive, he is impulsive, he is very restless. We are just unable to control him. Then I think it's always better parents seek professional advice.
Okay, so if the child is hyperactive, the child is inattentive and impulsive,
Yes.
and you're able to identify those small things in their daily life, in their daily routine,
Yeah.
then it's time to seek help.
It is. The child is not able to do the homework. or the school has given a project you need to complete by this deadline. The child doesn't want to do and wants to spend time watching TV or playing games or doing other things. It's always better and safer in the interest of the child.
And not think that it's okay, let's see after 2 years, or let's wait.
Yeah, I keep talking about that to everybody. You will wait, yes. But then whatever problem the child had, which was about say 10%, 12%, in 2 years it has become 30% or 40%. There's so many children. This is the issue which I keep highlighting, and it is which bothers me a lot. When you see something small, why don't you just solve it? Wait, thinking, yes, again the pampering. Child is so small, and like you mentioned, grandparents, yes,
They don't allow the parents to
Yeah.
look at problems. Everything is given a reason that, it's
they'll
normal.
they'll
it's
scream
okay.
at the son and say, "You are also like this."
Yeah.
And a father has nothing to do. He'll say, "Oh, I was like this, so my son is like this, like father, like son." But thanks to the internet, thanks to the movies, thanks to the media, people are getting this awareness, and I'm getting more and more parents now seeking out. Like I had one today. I had one this morning where this parent has gone to 4 specialists. Everyone has said nothing to worry about, but she was not convinced. She came here. I put her into a detailed assessment to see what
That's
are
so
the
good.
issues. Yes.
Such parents exist.
In fact, I congratulated her.
Yeah.
The child is 4 years and 9 months, or
Because
close
there's
to
a
that.
huge taboo associated.
Yes.
On the
Huge.
contrary, there are people who proudly proclaim that I have ADHD.
Well, that's
What is that?
become that's become like I don't know if you remember the previous decade. It was OCD.
Yeah.
People used to feel proud. I have an OCD problem.
Yeah.
For whatever they cannot do
Yeah.
or they are doing something, it is just like to say, I have this issue, so guys, don't bother me. So now, in fact, such a nice point you brought it out to me. I would say at least about 15 to 20 cases per month where they're self-diagnosed, gone on the internet, seen a few things here and there, and saying, actually, I have ADHD problem. I have ADHD problem. That, in fact, the way I look at it is they're abusing a diagnosis to get away with their stupidity, I'm sorry, or carelessness, or negligence.
Just abusing a diagnosis.
Abusing a diagnosis. I was
Maybe
not
to
capable.
escape from something, from work or something.
Just because I was not careful, I couldn't complete my task.
Yeah.
It's my lack of sincerity or not being diligent in my job. So it is wrong, and I have
It
done
cannot be
that.
self-diagnosed.
Not at all.
You need an expert.
Whoever comes, I put him on a detailed evaluation and say, hey, guy, look, you don't have ADHD. You just need to be more responsible and do your job. You cannot self-diagnose anything.
Especially a behavior disorder.
Yeah, and such a major one. Somebody who has it, the parent whose child has it, they know the issues they face at home and outside. It's not a joke. It's not a brand you're wearing.
Nothing to be proud of.
Nothing to be proud of.
So you spoke about ADHD, and so many people are self-diagnosing themselves with ADHD nowadays. So when is it that they should see a doctor?
They should see a doctor, or the parents should bring them to a doctor. Yeah. One, when these symptoms have become so severe, or they're going out of control and interfering in the daily activities. Now, these daily activities could be anything, starting from brushing, come out, or having a bath, 30-second shower. The child goes inside and comes out. We used to call it a crow bath. It does not even put shampoo, does not even spend time in a shower, so restless. Homework, complaints from the school, being impulsive, harming other children. So in the age group where we have the school going kids, if it is affecting their daily activities. The parents are unable to invite anyone home, or the parents are unable to take this child and go to any function or any social gathering, go to a mall, go to a show, sit in a movie theater.
Yeah.
Yeah, the child is getting up, jumping, screaming, and all the.
So the so-called mundane tasks are becoming challenging.
Challenging. You just cannot. You cannot even hit, slap, scream, shout, and make the child quiet.
Yeah. So the daily life gets affected.
Yeah.
Social situations are getting affected. Relationships get
Become
affected.
awkward.
Yeah.
So social situations become like, oh my God, we have to go there. Or, oh my God, these people are coming home. What do we do with him? Send him to the uncle's house. Or I've seen all these situations. So that's the time when you have to seriously think, yes, there is an issue. Let's try to see a proper professional. I've been talking about this in every podcast of mine. Because I keep getting people. We went to so and so, and he said nothing. As a child grows, he'll become normal. I never, ever do that.
Who is that professional in this case?
See here, I will tell you, the one could be a psychiatrist, 2, it could be a developmental neurologist, or 3, most important, the occupational therapist. I would always recommend go to a specialist who is seeing these cases.
Right.
Like I get so many cases where they have gone to a so-called specialist who's not aware of these developmental behavioral disorders. So they are not even able to find out and pick those deficits or issues which the child has. So if one therapist or one doctor or one psychiatrist or one clinical psychologist, somebody says your child is normal, I will not be happy. I'll want to take a second or a third or a fourth opinion and say, okay, out of 4, 3 people said it's normal, so I'm okay with that. Maybe I'm okay with that. Or till all 5 say no, everything is normal. So I will not agree for that.
Yeah, I think going to an occupational therapist is the best amongst all.
Yes.
Because there'll be a detailed assessment, a 40-minute session or a 50-minute session where you sit with the child, you assess all the areas. You do a semi-structured interview with the parents. Yeah, you get a whole lot of information. So now that we have spoken so much about ADHD, let's talk about ASD, the Autism Spectrum Disorder, very hot topic. So what is ASD and how does it present in young children?
Yeah. ASD, yeah, it's not hot, it's extremely hot topic. ASD, which means Autism Spectrum Disorder. Now, the word spectrum is because there are a lot of subgroups which are included in this big umbrella. But at the outset, I want to make this point very clear to whoever is watching this podcast or listening to this podcast. ASD is not a disease. Autism is not a disease. These children are not sick. They are not suffering from a disease. It is a disorder where the child's certain part of his mind or behavior or a lot of things which I'm going to talk about subsequently, instead of developing in one direction, have gone in a different direction. They have to be brought back on track, period. So this, I think, is very important because a lot of people have this misconception it is a disease, right? So how does it present in the initial stage or in the early years?
Young children.
In young children. The symptoms start generally around 18 months. 18 to 30 months is the time when most commonly we see here symptoms start appearing. There are issues which keep happening, and as usual, they go unnoticed. The important things here are, number one is the social aspect. Now, in social aspect, what are we looking at? Like for instance, now if you have a 1.5-year-old child, when you call the child's name, what will the child do?
Respond.
Respond. Yeah, you're talking to the child or giving the child a toy or something and say, come, whatever you want to call the child. Okay. When you're talking, what do you notice?
Child is looking at your face,
Face.
giving you eye contact.
Eye contact. Okay, so these two terms which are very, very important here. One is response to the name call. When you call the child's name, if you call the child's name, I have quite a few parents here who have given child some 5-6 names. Child doesn't know which name to respond. Okay, so if the child knows the name, okay, that's on a lighter note. And second, when you're doing something, the child makes a contact with your eyes. So if these are not there, there is some problem you need to be worried about. Then the next thing which comes here is the child prefers to be alone, solitary play. Does not go with anyone else, does not go with peers or the same age group kids, including siblings, including older brother or sister, or younger brother or sister, or I have twins as well. The child will not be playing. The child might sit alone in one corner, or there are a lot of kids I've seen where they just sit in front of the mirror and have their own kind of play. So solitary play, not interacting with the peers. Then the other component here is the child will not even know how to respond to emotional cues. If somebody is angry, child will not even know that they are angry at me.
Emotions.
Child cannot understand emotions. My mother or father is happy. Child does not know they are happy with me, or they're upset with me, or they're angry with me, or they are sad with me. So this is
doesn't even express emotions?
Yes. The child cannot express emotions, blank. You hug the child, you hug the head, doesn't know why you're hugging the child like a teddy bear. So that's how it is. Cannot express and cannot understand emotions.
So talking about the social aspects, so there is lack of eye contact, no response to name call. And you said the child likes to play alone. So what is this play? What is the nature of this play? What does the child actually do? What
Yeah.
is it?
See, this is an imaginary play. We call it solitary play technically here. The child imagines, has his own fantasy thing probably. And with the own thing, he is lost in his own world. He does not require any company. In fact, in my experience, where I had some of the children who were verbal and who were highly intelligent, when I've gathered a few things which I don't know what people who have seen similar cases have to say about it, or what exact thing. They have an imaginary friend. They imagine that friend is with them. They interact, they talk. You must have seen a lot of kids. They keep mumbling, they keep doing all this. So the next very important aspect of children suffering from ASD is communication. In fact, if you ask me, parents who come, they're more worried about communication than anything else. मेरा बच्चा बोलता नहीं है.
Yes.
My child is not speaking. They're not worried about the behavior issues. They're not worried about the cognitive, nothing. They just want the child to talk.
Speak. Yeah.
In fact, that's the reason my main focus is speech delay. Why is the speech delay? Try to look at the reason and solve it. So here, very, very important aspect of ASD is issues in communication. What are the issues in communication? Number one, there could be delayed development of speech, or there are a lot of children who had started speaking. And then after 1.5, 2 years, or 2.5, 3 years, there is regression. They start losing speech, which is very sad from the parents' point of view. They show me the videos. This is how the child used to sing on this birthday. This is how the child was. So the speech regresses and they lose. That's one. The second aspect here is some of the children have an issue where they keep repeating. Like you ask the child, what's your name? What's your name? Did you eat? Did you eat? How are you? How are you? Like a parrot.
Yeah.
This is known as echolalia, which again, I want the parents to be aware of this. This is not speech. Parents are very happy my child is talking.
This is the problem.
That's a problem. Yeah, his speech is not normal. He has to understand and answer. What's your name? My name is so and so. Did you have lunch? Yes, I had, or no, I didn't. So this is an abnormal form of speech, which is known as echolalia, and it is not normal. It is abnormal. So this has to be remembered. Third, these children, even when they start speaking, their tone will not be like when any person without the disorder talks. There'll be an intonation, where you go up and come down, and this will be flat, like as if I am talking to you, robotic voice.
Yeah.
In a flat tone. Or some children, you're aware of this. We have had children who talk in a sing song way. My name is. So,
Yes.
this is. Okay, so, this is the other issue with children with the ASD when it comes to communication. And finally, gestures. Limited use of gestures or no gestures at all. Like the old TV news readers, just looking blank and talking. There are no hand movements, no
Yeah.
expressions, and very, very flats. So these are the common issues which happen when it comes to communication.
Both verbal and non-verbal communication
Yes.
gets affected.
Gets affected.
So apart from social and communication skills, is there anything else that we should know about?
Yes, the audience should know, everyone should know of a very, very important part or a component of ASD, which is the behavioral issues. Now, when I say behavioral, I want to split it a little more into subgroups and explain what are these and why do these happen, which is again so important. And parents are not bothered about it. Not parents, therapists, doctors, they are not bothered about this. One is the sensory sensitivity, which is so vital here. Like the child may have abnormal reactions to certain sensory issues. It could be light, it could be the temperature, it could be sound, it could be smell, it could be touch, it could be taste, all these things. The child will react in a different way to these stimuli.
To the so-called normal sensations.
What we have, the vision, hearing, taste, touch, smell. In all of these, the child's reaction will be different.
Can you give us an example?
Like for instance, I like to eat only crunchy stuff. You give me something. If you give me apple, I will eat. Give me a banana, I don't want it.
So it's the texture that matters.
Yes. If it's a paratha or a toast, I will have it. Give me rice, give me khichdi, I will not have it. It is the texture of the food. Even if I may not chew it. I may just swallow it. Smell. Want to keep smelling. Food, I'll smell before eating. You give me a gift, I'll smell before keeping. Want to smell everything. Light. Can't take bright light. The moment the light comes, close your eyes or start looking here and there, or start looking, we call it lateral gaze, or the other way, seeking. Want to look at bright lights. Just go and lost looking at some object. I know kids who would love to keep looking at the sun, the bright sun, which nobody can look at unless you're wearing shades or something. So all these components. Sound. You hear sound, close your ears and start running and hide somewhere.
Yeah, we have a few children. We literally have to whisper with them.
Yeah.
They cannot even tolerate normal
Even normal
volume,
conversation, when somebody is screaming
they
or
start
somebody is
closing
talking
their ears.
loudly, they cannot take it.
Yeah.
Or the mixie, the blender, the washing machine, the pressure cooker,
Yeah.
the drill in the neighbor's house. All these things,
Highly distressing.
highly distressing. The child collapses. And parents don't understand why is this happening. I think they hit the child, slap the child, come on, behave yourself. No, the child does not know. His system is not taking it. Touch. People coming, such a cute child, no, don't come near me. Hugging child, I don't
Yeah.
want you. Just move away. Keep distance. The child does not like anyone coming close or touching. Haircut.
Yeah.
Two people have to hold. Or we have so many kids who have just grown a ponytail there. Shampoo, massage, head massage, cap
Yeah. Yeah.
or clothes. Socks,
Socks and shoes.
sweater, wearing a hoodie, the blanket.
They can't tolerate any of this.
Exactly. No, these are major issues which should be addressed to before you think of speech and talking. So, number one was the sensitivity to sensory phenomena. 2, these children can have certain repetitive behaviors. All kinds of, flapping. You get excited, you start jumping all over, keep moving your hands. Extremely common in these kids. So sensory, repetitive behavior. Then third, very common. These children want a strict routine.
Strict routine.
Yes,
That's good.
that's good. Very good, lovely, excellent. But if that routine goes 1 millimeter away, 1 microsecond away, the world is the end of the world. It has to follow exactly that. The meeting is at 2. It should get over at 2:15. Strict routine. I have to get up at this time, do this, and only this. If for some reason that second part was missing, my system will not take it. Following a routine so strictly that if you are unable to stick to it for whatever reason, the child cannot tolerate. The child will have an issue, will have a meltdown, will start crying, screaming, throwing a tantrum, any of these things. That's an issue.
So these children are so intelligent that they understand what a routine is.
They are intelligent. And that is how it is set. And everything based on time and sequence. That's how it goes. And it has to be in that sequence.
Yeah, I remember recently when the road was dug here and all the parents had to take another route to come to our center. They used to literally cry while entering because the child just doesn't want to take that route.
Exactly.
They want to get into this pit and then come.
There's only one right way. They cannot
So
be
inflexible.
anything else. Very rigid. Extremely rigid. If I'm going to eat this for my breakfast, I'm going to eat only that.
Every
and
day.
at that temperature. Every day.
Same breakfast
Same
every day.
breakfast every day at the same time. Lunch, the same thing, the same time. So that is,
There's no boredom.
there's no bottom. Okay, they love it and that's life. That's life. Then finally, their focus can be so intense in certain special things, which will make you just wonder what the hell is happening. I have so many examples to give and they're mind-boggling. It could be alphabets. Give them a word which has 15 alphabets. Tell them paragraph. Before you think, they can spell that word in reverse.
Without formal education,
Wi-
without going to school.
Exactly. Exactly. Give them a full sentence. The entire sentence, they can spell it in reverse order. Number. I have so many kids with me now. Give them a 5-digit number multiplied by a 6-digit number. Before you take a calculator out and start running, was it 74325? The answer is there.
Yeah.
Drawing. They look at the person and that's it. Half an hour later, the pencil sketch is there, exactly there, which resembles 100%
Wow.
that person. Music. Listen to a song just once. The entire thing is saved here. They can reproduce it. So there are a lot. The list just goes on. If I keep telling you what I've been seeing for my last 36 years, I don't know how many podcasts we need. There are a lot of such stuff which I've collected and kept from my kids. Each thing is a masterpiece.
They're gifted.
They're gifted, and that's exactly what I tell all the parents. Let's try to find that talent and let's groom. This child can become a genius in that particular field. And that's exactly what happens. So we spoke about social, we spoke about communication, and we spoke about the behavior. So these are the salient features of the commonly found symptoms in children suffering from autism spectrum disorder in the younger age group. Well then, guys, Dr. Naeem Sadiq from Plexus, from the channel Dr. Brainstorm, signing off. Thank you for joining in this episode on neurodevelopmental disorders in children. Tune in to part 2 of this very interesting topic, wherein I'll be discussing about management and the several interesting facts about this. Now, till then, bye-bye.